Good morning, everybody, and thank you for joining us for the IWH Speaker Series presentations on May the 11th, 2021. My name is Peter Smith. I'm a member of the scientific staff at the Institute for Work and Health. Before I introduce today's speaker, Aviroop Biswas, I would just like to remind people that if they want to hear more about news and events from the Institute, they can sign up at any time at iwh.on.ca/subscribe. The link is at the bottom of Avi's first slide here. In today's presentation, we will be taking questions and comments in the chat box. So if you do have a question or a comment, if you could please just enter it into the chat box, and we'll be addressing all the questions at the end of today's presentation. So without further ado, I would like to introduce Aviroop Biswas. Avi is an associate scientist here at the Institute for Work and Health. He also has an assistant professor position at the University of Toronto in the Dalalana School of Public Health. And Avi will be discussing today the health paradox of physically demanding work. What is it, and should we be concerned about it? So over to you, Avi, for your presentation. Thanks very much.
Thanks, Peter. So I want to start by saying thank you all for joining me today. For those of you who aren't my family members, especially so. And as the title gives away, speaking about this health paradox of physically demanding work and speaking to some of the evidence in support of this paradox to explain really what it is, and explaining that while the evidence could be mixed, spoiler alert, I think we should be concerned. That being said, I want to also give you at the end some takeaways as to what we need to be doing about it if you find yourself working in this type of work or know people involved in this type of work. So just to start off with the key takeaway messages that I will be reiterating at the end. There is a signal, a consistent association in a lot of studies, though of course I will be showing the evidence is still mixed, that links physically demanding work, strenuous manual labor work with detrimental health outcomes, such as heart disease and early death. But I also want you to take away that this doesn't mean that we shouldn't be engaged in healthy exercise and physical activity for health and in recreational time, and that they can coexist. But maybe we need to be thinking about a graded approach, especially for higher risk workers. And I will be explaining who these people are and assessing that and recognizing that this physically demanding work might require strategies for people who might need more tailored approaches that consider their own capabilities and capacities. So I want to start off with a history lesson. And for anyone who's involved in physical activity research or aware of this work in general, they will be very familiar with the study by Morris and others in the 1950s on workers in a double-decker transit system in London. Prior to this work, the information, we take physical activity research for granted. We consider the recommendations for physical activity as, kind of something that we all kind of grew up with. But prior to this work, it wasn't all set in stone. We didn't have these large studies that really told us that physical activity is really beneficial to health. And while people had anecdotal evidence, it wasn't really confirmed in large population level research studies. And so the team with Morris and others basically had this hunch because there was this this trend in the workers in the double-decker bus system where they found that there were varied levels of heart attacks, what we call acute myocardial infarction, among the workers. And so what they hypothesized was that it was something to do with their movements. And this kind of went against the grain of what the prevailing thought was at the time. They thought that the healthy effects of lifestyle were more to do with our physiology and our physical health, how heavy we were, so our body mass index, the amount of fat we had in our bodies, and the amount of stress we had. And it wasn't really linked to how much we were moving in our day. And so they hypothesized something that kind of went against the popular thought. And so when they looked at the conductors are people who are kind of moving up and down these double-decker buses and doing a lot more movement than the drivers who are stationary and solitary, just focusing on the road for long periods of time in the day. And as this graph shows, you see that in the shaded are our conductors, and they have far lower levels of acute myocardial infarction or heart attacks compared to the drivers. But there was a lot of cynicism and skepticism, and they said, well, how do you know it's not to do with stress? It could be skeptical and say, well, the conductors are having to deal with a lot of people. Sometimes they have unpleasant encounters where people are in terms of dealing with tickets. And so that could be a stressful encounter, while compared to the drivers who are very, you could say, in a very monotonous, repetitive job and not as stressful. And so they did another study and a follow-up where they looked at 3 other types of workers. One being postmen, postmen being very active on their rounds, but also you could say in a stressful job, and that they had to deal with people at the time. I'm not sure if they have to deal with people now, compared to telephonists, who are, I guess, switchboard operators, who aren't moving a lot, so they're at the switchboard, but they are dealing with a lot of people. So, I guess the consistent theme is that if you're dealing with a lot of people, that's a stressful thing. And then compared to clerks, who are very sedentary and stationary, and aren't dealing with a lot of people and doing very monotonous, passive work. And they found with this difference, with the postmen being more active, but also involved in stressful encounters, they still had lower levels of heart attacks and lower risk of heart attacks compared to telephonists and clerks. And they found that this association was consistent for people based on their sex, their age, and based on differences or being like for like on their body fat and body mass index. And so this was really the start of these larger scale studies looking at the association and the benefits of moving and being physically active on health. And now I thought to bring up this example because I think it's important to reiterate that the origins of this physical activity epidemiology started with workers. And with the work of Morris and others, they really didn't focus on workers after that. They really focused on promoting physical activity during recreational leisure time. And the thought process at the time was that the workplace was really hard to change. People don't have a lot of control over what they do on the job. They don't have a lot of opportunities to engage in a lot of that high intensity physical activity. And so they thought the best place was to really promote this outside of work. And there's been a lot of strides in promoting leisure time physical activity, but it's also taken the focus away from what people are doing on the job in terms of physical activity. So I want to start off with the first poll, which is what you guys think the physical activity recommendations are. And so I'd like to spend maybe 30 seconds, and I believe you can make multiple choices here. And I see the options. So the first one being move as often as you can per day. Second being 150 to 300 minutes of moderate intensity physical activity per week. And then 75 to 150 minutes of vigorous intensity. So the difference being moderate intensity is things that start to get you, a little tired. Brisk walking, gardening can be moderate, and then 75 to 150 minutes of vigorous, which is things that start to make it hard for you to speak, and you're sweating, so jogging, skating, skiing, and then some muscle strengthening, so your resistance training, and then the last option being 10,000 steps.
So I don't know if you can see this, Avi, but I can see it, and I'll read you the responses. You can see it? I
can see it, yeah.
Oh, okay, great. So I'll let you describe.
Great. So yeah, I see a variety of answers, and it's like a good spread. I think that the most common ones are around moving as much as you can and meeting the 150 minutes of moderate intensity with some strengthening exercise. And so I think in general, I put the last one in there, the walk 10,000 steps. It's not wrong advice, but it's not explicitly mentioned in the guidance. But in general, the first 4 are what are explicitly mentioned in the recommendations. And so what are the recommendations? And so this is the latest recommendations from the World Health Organization, and they suggest we undertake, everyone undertakes regular physical activity, all adults should, and trying to do over 150 minutes of what we call moderate intensity physical activity, and at least 75 minutes of the more intense, vigorous intensity physical activity. So things that make it hard for you to speak, you're sweating harder profusely, and then incorporating resistance training to strengthen your muscles, and just a combination of that for most days of the week. And then In Canada, we have a more of a 24-hour approach that incorporates healthy sleep routines, trying to limit the amount of time you spend sitting throughout the day, and then incorporating those 150 minutes and with muscle strengthening, but also incorporating light intensity movement. So this idea that move as much as you can a day, including standing. And the reason I brought these guidelines up is that there's nowhere really there that speaks to the domains of where we engage in physical activity. And it said all adults should engage in as much physical activity as possible, but there's nowhere there really speaks to workers. And that's important to highlight because work can be quite physically active. And I've shown these pictures on purpose because these are working populations where the demands of work have been studied, are being studied. You have a cleaner and somebody working construction, and then someone working in manufacturing on the right. And what these people have in common is that they're engaged in exercise, or I guess I shouldn't say exercise, in movement that is done in a totally different way to what we would consider to be exercise or even resistance training. It involves a lot of intense effort, strain on the body, very physically demanding work where you often don't do a lot of warm up. You do it because it's part of the job, and you don't really think about actively, mentally thinking about taking breaks. And it's this type of work which we associate with this paradox, in that it's a paradox because we always think of physical activity as being beneficial for health, but with this emergence of research suggesting that this type of very physically laborious, strenuous work can have health effects, it's a paradox because it goes against the grain of that thinking, and it suggests that some forms of physical activity, and a lot of times to do with work because we have to do it, are not beneficial and might be even bad for you. And so they're still teasing out why that is the case and what the effects are on our body. And these are some of the options in bullets, that it has no benefits to your fitness. And when you think about fitness, fitness is essentially a concept where if you think about your heart as a muscle, you want to train and strengthen your heart to be as effective and efficient as possible in pumping blood throughout your body. And that is essentially what your fitness is, and you train that through exercise. And with this strenuous work, you're not really building on the capacity of your heart to be able to do that. You're really just putting strain on it. And those strenuous movements are putting a lot of pressure on your heart and increases your heart rate and blood pressure. But at the same time, it increases the inflammation in your arteries, which makes your arteries more likely to be clogged and blocked, and increases your risk for heart attacks. So it's essentially what researchers in this field think is happening with this physically demanding work. And this is one of the more recent studies illustrating this. I just want to draw your attention to the graph on the left. And this is among 104,000 men and women aged over 20, followed for 10 years in Denmark. And on the left, so this is a 3D graph. So the axis closest to you is the levels of recreational physical activity. And then the axis kind of moving away from you is your work-related physical activity. So just to orientate you to the graphs, the gray graphs, the higher the graphs, the higher risk for cardiovascular events. And so you see the highest peaks are for people who are most sedentary at home or in recreational time, so low levels of physical activity, and very high levels of physical activity at work. But what's interesting as well is that you see that people who are engaged in very high levels of leisure time physical activity, so now you're looking at the green, so at the very right, and then at very high levels of physical activity at work, they're also at very high risk of cardiovascular events. So there's something there. You would typically think that the more movement you do, the more vigorous intensity movement you do, the lower risk you would have for cardiovascular events. But there, at least in this study, and other studies are showing that there seems to be this contrasting effect, and that there's a net risk when you're linking the two on cardiovascular disease. And so you see the same trend for death from all causes. And so what I've seen through the research is that there is a difference between who you examine. And so the biggest effects on health risks seem to be on people who have pre-existing health conditions. And so physically demanding work seems to be most risky for people with pre-existing conditions. And so this is a study on over 12,000 female nurses in Denmark between the ages of 45 to 64 years of age, followed for 15 years. And so on the left in the blue are people with normal levels of blood pressure, so we call them normotensive. And so compared to a reference group of people who just engage in moderate levels of physical activity in this nursing job, people with higher levels of occupational physical activity, and so people above 1, it's not statistically significant in that the vertical line doesn't pass 1, and it tells us that this 29% increased risk might be due to chance. But then when you factor in people who have pre-existing hypertension, so already risk of heart disease, engaging in moderate and highest risk being engaging in very physically demanding work, a far higher risk of heart disease. And so that pre-existing hypertension does increase their risk for heart disease. And so I'm trying not to cherry pick, but I have, and I promise you've seen these consistent trends in the literature. And so this is looking at risks of atherosclerosis, and atherosclerosis is essentially the hardening and blocking and clogging of the arteries, which is another risk factor of heart disease, getting a heart attack, because you're essentially preventing the blood from flowing efficiently around the vessels. And so when you look at people with pre-existing ischemic heart disease, so people with coronary heart disease, blocking of the heart already from allowing oxygen to get back into the heart, people with that pre-existing condition and engaged in physically demanding work are at highest risk of getting atherosclerosis and future heart attacks. And so this was among Finnish men followed for up to 11 years. And then I mentioned about the heart and the fitness, like thinking of the heart as a muscle. And you do that, you strengthen that muscle through regular exercise. And so when you think about fitness, and you look at, and this is a study following Danish people for over 30 years, when you think of people with high fitness, these are actually people who are engaged in physically demanding work. The risk actually goes down, and to a point where they are at a 20% lower risk of getting a heart attack. So this is the group in blue on the left, versus people with low fitness who haven't had a very well-trained heart, not physically fit, and when they're engaged in physically demanding work, they're at higher risk of getting heart disease. And so this kind of goes against the conventional wisdom for promoting physical activity towards people who have pre-existing conditions, what we call secondary prevention. So you think of cardiac rehab, for example, and to me it suggests that the way that physically demanding work it goes about and people actually undertake it is very much different to physical activity for recreation. And so if I haven't really brought that message home, maybe it will be a good example to take lessons from elsewhere. And so a place to get that lesson I found really helpful for me was snow shoveling. And so I've added a sorry because it will be the only slide which I will bring up snow again for all of you. And for those of you who have to experience snow again, I'm so sorry. And I thought snow shoveling was very much a good analogy for comparing physically demanding work to it, because, well, if you think about it, you've experienced a lot of snowfall the night before and you have to get to work. So you put on your coat and then you go out. You don't really think about warming up. And then you go out, you pick up your shovel and you're lifting heavy loads of snow, right? And so that's involving a very physically strenuous, demanding activity that is static in that your legs are kind of planted on the floor, dynamic movements because you're moving your arms up and down, and then a lot of intense arm effort and repetitive movement. And so that puts a lot of oxygen demand on your heart, and usually done, again, like I said, with a little warm up. So, every time you lift your arms up, you're putting a lot of, you're creating those spikes of blood pressure that contrast between the distance between your legs and your arms. And so your legs are feeling also a lot of tension, and then you're getting these spikes of blood pressure. And so at rest, your oxygen supply to your heart isn't challenged much, but during exercise, your heart's oxygen demands really increase dramatically. And so if you're healthy, your heart adapts, you're fit, your heart adapts, your heart beats faster, sending and supplying additional blood and oxygen to your heart. But if you have existing coronary disease or in poor physical shape, the blood flow can be blocked or flow less efficiently, potentially making the heart starved of oxygen, leading to irregular heartbeats or a heart attack. So for me, that really hit it home for me and really helped me understand what it is about physically demanding work that could be bad for your health. So that being said, as researchers, we still need to verify whether these risks are plausible. And so a lot of this research is around heart disease, but sometimes we need to be evaluating what happens before that. And so what has been, like I mentioned, postulated is that physically demanding work doesn't have any benefits towards training your heart. It doesn't really burn a lot in terms of energy expenditure. And when you think about something like diabetes, physical activity is so important towards diabetes control and preventing diabetes, because we do the opposite. We train our heart to efficiently improve the way we reduce blood sugars in our blood, improves insulin action, but it relies a lot on our fitness levels. And diabetes is also very much impacts our inflammation of our vessels. If you have diabetes or at risk of diabetes, your vessels become more inflamed and you're at risk of future atherosclerosis and heart disease. So a study we did at IWH was to evaluate whether whether diabetes really fits this health effects that we're seeing, we think is possibly associated with physically demanding work. And so we had two research questions. One was to really examine how occupational physical activity and leisure time physical activity separately affect the risk of getting diabetes in the future. And then when thinking of the two in combination of each other, engaging in physically demanding work and then engaging in leisure time physical activity or meeting the recommendations, how does that impact the risk of getting diabetes in the future? And so this work is published, and if I don't do justice in explaining it, feel free to find the paper or contact me for the paper. And the citation is here. So what we did was we looked at people who responded to the 2003 Canadian Community Health Survey. And so this survey was administered throughout Canada, but we looked at only people who responded to it in Ontario. And the reason we did that is because we had an Ontario database of diabetes claims that were clinically informed. And so these claims were based on hospital discharge databases and physician and laboratory claims. And because we had people who responded in 2003, we had diabetes claims from 2003 to 2017. So we had 15 years of future data to look at when people had their first event, diabetes event, as assessed by a medical professional. And then we verified that these were people who didn't have any pre-existing diabetes. And so we made sure that these people were workers, had no pre-existing diabetes conditions in at least the first 2 years of being followed up. And so with this Ontario working population followed for 15 years, we had over 7,000 workers who were analyzed. And so we're looking at the links between physical activity and diabetes risk. For leisure time physical activity, it was based on the surveys. In the surveys, we looked at various socio-demographic factors, but also the times they spent and in different activities related with recreation. And so they self-reported this. They told it to the person administering the survey and whether they did this. And then we added it up and wanted to see whether they did at least 150 minutes of leisure time physical activity. So whether they met the guidelines, or if they were less, if they engaged in less than that, which we called our low leisure time physical activity. So meeting the guidelines was high and not meeting was low. And then we looked at occupational physical activity. So instead of asking people to report what they did, which we thought was limited in that you're expecting people to really report the types of physical activities they do at work, which is hard to really assess and have people remember accurately. We based it on having people report the jobs they did, and then we had a database where experts in occupational health rated these occupations for the intensity of physical activity engaged in at work and the typical body postures engaged in as well. And so in blue are what I pulled out from the database as being associated with these different levels. The first group being people who engage in very low levels of physical activity on the job and very sedentary and stationary. So these being your librarians, administrative professionals, managers, researchers, maybe more white collar jobs. And then second group being people who are in these low levels of physical activity, but incorporating some movement, so standing, moving around. So these being your storekeepers, manufacturing supervisors, retail salespersons. And the third group being the high physically demanding workers, involving a lot of heavy lifting, and these being paramedics, nurse orderlies, postal carriers, air transport attendants, machinists, and laborers. And so the separate effects is what we first studied. And so on the left, you see the effect of meeting and exceeding the physical activity guidelines on diabetes risk. And so anything below 1 means there was a reduced risk of getting diabetes. And so not a surprise, and because there's been so many studies that are verified this, suggesting that meeting and exceeding the guidelines for physical activity is really, really helpful and beneficial to reducing your risk of getting diabetes. And so here we found that to be the case with our data. But then when we incorporated or examined physically demanding work at different levels on its own, we didn't really see any consistent signals. It was kind of wonky. There wasn't anything to really tell us there was something there. But then when we incorporated both leisure time physical activity and occupational physical activity, we thought the trends were a little interesting. And so if you look at the very left in blue, and you think of people who meet and exceed the guidelines but are very sedentary and stationary at home, at work, these people are still getting a lot of benefit in reducing their diabetes risk. They have a lower risk of getting future diabetes. But as you increase the levels of occupational physical activity, so as you move from the left to the right, but you're still meeting the physical activity guidelines and recreational time, those benefits that come in from reducing diabetes risk tend to go down and actually tend to trend towards a higher risk. So what does that tell us? Well, we came away with it thinking, well, physical activity recommendations are really important for diabetes prevention and management, but the benefits seem to be most for the most sedentary of workers and maybe less effective for those already engaged in physically demanding work. So then why might this evidence be mixed, and why do some studies show mixed evidence? Well, it might be because of the type of workers we sampled. We focused on healthier workers. And like I said, when you really focus on, and then we've seen fewer studies that have looked at this, but focused on less healthy workers. And of course, people in physically demanding jobs aren't always the healthiest people and can also be unhealthy. When you focus on them, you see a more consistent signal between physically demanding work and health risks. And so maybe we need to be thinking more about focusing on these more vulnerable populations. The other reason the evidence might be mixed is the way we measure work-related movements. And so we've really been reliant on large studies that focused on populations of people and getting them to complete surveys. And with surveys, we're having people tell us what they're doing on the job. And that is limited. We can't expect that people will actually know what they're doing in different work tasks, and that this information will be reliable and accurate. The other thing is that people tend to report what they think is desirable to researchers. And so sometimes we tend to get a skewed view of what is actually going on. And the people who respond to these surveys might also be more healthy compared to the general population. There has been leaps and strides made in terms of incorporating more accurate device-based measures, and so things that are like our iWatches that you would wear on your waist or on your wrist, and that would measure your movements. And so these have been really successful in measuring leisure time physical activity. You might have them on your wrist right now, but they're not as good in measuring upper body movements and things to do with strain and physical strain on the job. That being said, there have been some studies now that are incorporating these devices on your arms and various points in your body. And it's now just a matter of making sure that more and more studies, larger studies that are incorporating a variety of different people and workers are doing this, and that this type of measurement is scalable and cost effective as well. And so now I've presented, some reasons why the evidence is mixed, and I'd love to hear from you as to why, what you would do about it before I tell you what I would do about it. So this comes to the second poll, and someone please load it. So the first option being nothing at the moment. You don't think there's enough high quality evidence to do anything about it. And the second thing is that we need to still promote healthy workplace practices to address physically demanding work. The third is kind of maybe similar, which is promoting breaks and rest after physically demanding work. And the fourth being eliminating physically demanding work entirely. Maybe we'll get machines to do it, or just transition to less hazardous work if we can. So I don't know how much time has elapsed, but we'll give ourselves 30 seconds, and you can, I think, make multiple choices again.
Can you see the poll at the moment? Okay, so let me tell you what the the responses were 2% of people said nothing at the moment, there's not enough high quality evidence. 90% of people said promote healthy workplace practices. 84% said promote breaks and rest after physically demanding work. And 9% said to eliminate physically demanding work entirely.
Wow. So I think I don't know, I'm not going to plot it myself too much, but I think at least I've got my message across, I think, because that is really what I think is needed to be done. I don't think it's about waiting till we have better evidence. I don't think that if we see a signal where we're seeing that at least the most vulnerable workers, people with pre-existing health conditions, are at risk, then we need to act, and we need to be tailoring recommendations based on those people and their capacities. An example is when we think about, for those of the 2% who are thinking about needing more evidence, I draw your attention to physical activity for health in general. These recommendations weren't based on randomized control evidence. They were based on these large-scale studies, and at some point people felt there was enough evidence to think that we needed to at least promote these recommendations. Then of course in the future we had better tailored studies and focus studies. So I think we do need more focus studies, but I do think we need to act. And then in terms of focusing on these high-risk people, it's important that we think about these strategies that get people to warm up before they start engaging in physically demanding work, because we see that warming up is so important for training the heart, and then cooling down afterwards, and taking breaks to give yourself some time to recover. That being said, to my second point, I think that physically demanding work and the recommendations for physical activity for health should still come hand in hand. It isn't just a one or the other. We need to be thinking about ways that we can improve the overall health of workers. And so that can come through policies and in the workplace and in public health, where we help workers engage in more physical activity to really boost their fitness, boost their overall health, so that physically demanding work isn't unhealthy, and gives them that opportunity, that capacity to do that work better. And so, because we can't really eliminate physically demanding work, but we can at least make it more safe for more workers. So it was a pleasure to speak to you all, and I'm looking forward to the discussion. If you have any more questions that I can't answer next, feel free to tweet to me or email me. And I've given the citation for the paper, and I believe the YouTube video of this will also has been recorded and will be sent out shortly. So thank you.
Great, thank you very much, Avi, for your presentation. Just to remind people, if you do have a question for Avi and you'd like it answered today, if you just want to put it into the chat box, we'll be going through the questions. We already have a number of them, and we'll be trying to answer as many as we can today. But if we don't get to your question today, you can give Avi an email, or you could tweet him, I guess, and he'll answer your question then. So Avi, the first question is just around this combination of occupational physical activity and leisure time physical activity. Is it possible that it's just, when you try to do both, it's just too much, so that the physical activity curve is almost like the stress curve, where there's an optimal amount and then too much is almost the same as too little?
Yeah, I think that is what some people are thinking, and that there might be this optimal amount. And I think that still needs to be tested. And there haven't been enough studies to really focus on this relationship of the two together. I've shown one, but I guess what I've been finding in my research and seeing in other studies is that, at least in terms of the strain, that seems to, at least perhaps psychologically, maybe physically, seems to take away from your, at least from your ability to engage in physical activity outside of work. Does it actually compound and impact your heart? Some people seem to think so, and that if you're already engaged in physically demanding work and then engaged in a lot of physical activity outside of work, maybe that's really bad as well. I don't know how many people actually do that. That would be interesting. Is that a sizable number of people? I'm not sure. Some work we're doing at the Institute is trying to find that optimal level of movement at work and outside of work that's linked with positive health benefits. And so maybe some point in the future I can share those findings with you.
Great. You spoke a little bit about, I guess, workplace-based policies that might be able to be put in place to make physically demanding work a bit healthier. Is there anything you think could be done more at a systems level, so say at a provincial level from the Ministry of Labour, Training and Skills Development, that might that could be useful at this point around the occupational physical activity paradox?
Yeah, I appreciate the question, because I think it's important to go all in terms of the guidance. And I think it's important to create this culture of safety and health. And it's not enough to recognize this and to just tell people to kind of preach the message, but to create this culture in organizations or in health and safety at the provincial level, where we say, it should, before engaging in any kind of physically demanding work, we need to warm up. We need to stretch. We need to give ourselves an opportunity to really prepare for that activity and then cool down afterwards. And of course, I'd ideally like to have done this, love to have said, focus on the people at highest risk, but we don't necessarily know who those people are. Some of these conditions are hidden. But I think if we say, a blanket statement where we tell all workers that this is what we need to be doing. If you're engaging in this work, there is this risk, and that we need to be telling we need to be telling people, and it starts from the organization. It needs to be starting from policies, and telling people that we need to be thinking about warming up and cooling down as being really, really essential to reducing those risks, and we need to be doing that.
Okay. A few questions just around other health behaviours, and so things around sleep and nutrition, alcohol use. Could you maybe describe for the audience how those things are related to both, I guess, physical, leisure time activity and occupational activity, and how you account for that or how others have accounted for that in some of the research that's been done today?
Yeah, so what I've seen is that the better, I guess, the higher quality studies have generally accounted for it by what we call controlling for it, by making sure that people have with different levels of alcohol consumption, or different levels of or comparable levels of alcohol consumption or smoking, and other kind of lifestyle related behaviors are compared to each other. And we call that controlling or adjusting for something in our models. And so the better studies have really done that by having people report in the surveys what they're doing in terms of their lifestyle, and then in the models they control for that, and so they can really isolate the effects of physically demanding work on health. In terms of the interplay, I haven't seen any studies that really focusing on people with different lifestyle characteristics like sleep, alcohol, smoking, and things like that, with the interplay on their physically demanding work and health. But that would be interesting to look at. So in general, they look at people by already controlling for it, but not in terms of the interplay. I'm not sure if I've answered the question entirely.
That's pretty good. Okay, but we've got a lot of them. We've got a bunch of questions today, so let's keep moving through. So what about workers who are returning to work? Could be after a work injury, maybe it's after a work absence. So if you're returning to a physically demanding job, you were giving the example of snow before, are there particular things that those workers need to be concerned about compared to, say, a worker who's doing a physically demanding job on a day-to-day basis? So someone returning to a job versus someone who's continually engaged in it.
Yeah, I think because we're seeing at this point a higher risk among people with pre-existing health conditions, and somebody who's kind of been away from the job, maybe their fitness isn't the way it used to be. I think at least the most basic message is to take it easy, go slow before you go hard, and so it makes that message of training yourself even more important than otherwise. And so we see this in my past world in cardiac rehab research. We see this in cardiac rehab, where someone who's been away from any kind of intense training, they're not told to kind of go into intense training, but they're told to kind of work towards a healthy level, but you work towards it by going low and slow first. And so I think that would be a helpful message for people going back to work.
Great. Just a question around the physiology behind the relationship between occupational physical activity and some of these health outcomes. Just if you could get into just maybe a little bit more detail about how the physiological response to occupational activity is different to leisure time activity?
Yeah, so I think the really unsatisfying answer is that they're still trying to figure that out. I don't think I've seen a really clear physiology-based study that's really been able to say this is what's happening. I think the hunches have been based on trying to make sense of what's happening from a lot of the research in the area, and you know, of course, and pre-existing research on, say, shoveling and things like that. I think the best way for me to explain it to you is that don't think of physically demanding work as being the same as exercise. I think there is exercise you can do at work, but that is different to the types of physically demanding work that we're seeing in these associations. And that is more to do with strain and demand on the body, with very little break and rest. And so back to the analogy with snow shoveling, it's that you're essentially putting a lot of stress on the untrained heart. And if you have more training, your heart can adapt and pump blood. And essentially your heart is always trying, it's always in this, even at rest, it's always trying to pump blood throughout your organs, to your lungs, back into your heart. And when you have, you know, some blockages in your heart, that effective kind of flow is hindered in some way. And then when you put a lot of pressure on your body by putting a lot of strain, that heart is working extra hard and doing that. But then if it's not pumping blood as effectively, and it goes to the lungs to pump oxygen back to your heart isn't getting enough oxygen. And so by doing that, you can put your risk of heart disease, heart attacks. And so by taking breaks, you're letting your heart to really recover and kind of adjust and adapt back to what is a more healthy, safe level of blood circulation. So I think that'll help. But I think over time, with more research, we'll be able to really tell you what's really going on, maybe at the genetic level as well.
Okay, a few questions about workplace policies and maybe your thoughts on what good workplace policies would be. So for an employer who has a number of members of their organization who have to engage in physically demanding work, which is not possible to change, what could their priorities be? Some people in the chat have suggested, you know, should there be designated warm-ups before people start work in certain occupations? Do you have any particular thoughts on what employers who have a lot of their workforce in physically demanding work could do in terms of policies or procedures?
Yeah, so I appreciate this because I think I appreciate that the perspective is from the employers. I think to get people to actually make a change, it's important that the employers drink the Kool-Aid and believe in this, that this change in behaviors really starts from the organization and the culture of health. I mentioned that before. And so what can employers do? Well, I think first of all is to really value the importance of addressing the risks that come from physically demanding work. And so what they could do is mandating or prioritizing the importance of warming up, adequately preparing and to engage in physically demanding work, and then recognizing that it's important for workers to take a break if they're feeling exhausted, and not just having to, you know, do as much as they can because they have to do it to finish their job, but that, you know, this work is dangerous, and I think it's important that we recognize that, you know, a healthy workplace is important for the employers too. It means that they gain far more for their bottom line. And so I think consistent messaging should around warm-ups and cool downs that start from the employer. And I haven't seen any messaging yet, and I think that is important that we still get this message across to as many people, but I think that it should start, really the buck starts and stops at the employer.
We have a few comments in the chat almost around sort of a very common phrase in Toronto now around workload management. You know, whether even that should be something that employers might consider around if workers are engaged on a regular basis, maybe there needs to be some sort of management of their physical demands throughout the work week so that they can continue to work like Kauai used to a couple of years ago. Okay. So yeah, there's a few questions just around recovery. So what are the factors that might go into adequate types of recovery for workers who are engaged in physically demanding jobs?
No, I don't know the answer to that yet. I don't think I'd love to see, something conclusive as to what is that level of adequate recovery. All I can say is that just like you would do when you were doing any kind of resistance training, read your body, and if you feel like you can't do any more, then maybe you need to rest more, and don't push yourself. I think that is a message that at least resonates with me. And I think if you see more research here as to what is adequate recovery from a physiological sense, I can give you more answers. But I think it's about just taking breaks when you feel exhausted and tired, because usually that is a signal to tell you that that is what is happening more physiologically as well.
Are there any, given the aging nature of the workforce, how will this current research be impacted into that trend where we've seen workers generally older and working for longer periods of time? Are there any particular implications for this work given the aging nature of the workforce?
Yeah, I think that as we see more aging people, I think if we see more aging people in more physically demanding work, I think it becomes a lot more relevant. We have seen, even with physical activity, that physical activity in general, leisure time physical activity reduces as you age. And so it makes, promoting the guidelines even more important as you all get older. It just declines because, you have more things going on in your life, or it's just harder for you to incorporate more movement as your body isn't as fit as you were. But if you see more older people in physically demanding work, then I can at least postulate, at least kind of hypothesize that if you aren't as healthy as you maybe were when you were in your 20s, and you might have these hidden risks for heart disease, and as you age, you are always at more risk for chronic conditions, and so it makes it more important to think about doing physically demanding work to the most of your capacity, and taking breaks and warming up. But I think there aren't a lot of studies that I've seen that really focused on age differences, but I think there will be. Maybe I'm just not aware of them as much yet.
Okay, great. A few questions just around, I guess, some of the definitional issues around what is physically demanding work. So around, is it just a matter of the amount that you're lifting? Should other factors be brought into consideration? Has the research in this area, is there a shared consensus about what is a physically demanding occupation? In terms of either the nature of the work, the duration of the work, or the intensity of the duration of physical activity. Could you comment on, I guess, some of the definitional issues about what is a physically demanding occupation?
That's a great question. I don't believe there is a consistent definition, and I think that is one of the reasons why the evidence is mixed. I've seen a lot of different definitions. Speaking to the diabetes study that we did, our study was really the first among all the others that I had kind of done a review of the literature looking at occupational physical activity that really considered body position and the intensity of work. And I think some studies that it's kind of said that they were looking at occupationally physically demanding work were just looking at it as a form of exercise. Like, if you're doing a lot of running on the job and things like that, but not really considering pushing and pulling. Then there's been other studies, and kind of the ones that are informing this physical activity paradox, that are looking at the load we put on our bodies. So how much pushing, pulling, and the different positions and postures that we engage in at work. And so I think that is generally what is, I think the definition is that there isn't a shared definition, but what is the consistent measurement during those studies are that it's to do with a demand on your body and doing a lot of awkward, repetitive movements throughout the day on the job. And so a lot of lifting or heavy loads and things like that. The definition we used in our study was for high occupational physical activity was anything involving lifting more than 20 kilos, and in awkward body positions involving lifting, pushing, and pulling.
And I guess one of the questions was in particular about whether within those definitions around sort of the average, if we need to better take into account, how are they lifting it? Is it at which positions? What's their body weight? What's their body height? And how we might be able to incorporate those things better. But at the moment, I guess it's a bit hard with some of the questions.
Yeah, I think we're at this. Sorry, if I could just add, I think it's important that we we address that. And I think, this type of work is really, I think, helpful to kind of start the conversation. And I think in future, I'd love to see more graded approaches where they think about workers of different body mass index and different levels of physical activity with different definitions. And yeah, I think we have to get there.
So there's just a couple of questions related to a particular, just around environmental factors. So if there are particular considerations when physical activity is done, say in areas with high pollution, when physical activity is done in high heat or high humidity, what are the considerations that people need to be aware of in those types of situations?
Yeah, so if I was just to say, just focusing on the evidence, I haven't actually seen studies on that. They've generally focused on not asking those types of questions. But if I was just to kind of come up with analogies, I think there would be at least a strain. I think that they come hand in hand, environmental stressors and physical stressors. So the snow shoveling example is a good one in that, I mentioned the physical strain, but there's also a lot of strain that comes from being out in the cold. And so being out in the cold restricts, constricts your vessels and puts, and your heart pumping, your heart rate and your blood pressure just rises. And so there is that interplay between the environment and the physical strain you're putting. And so, similarly, if you're in and so, I can imagine people working in construction and physically demanding jobs, working out in the cold here, like we have here in Ontario, for many months in the year, have to do the same thing. In high humid conditions as well, your heart is always having to adapt to what your body is doing and adapting to these environmental stresses being placed on the body. So again, I do think, and I'd love to see more research studies in this area, that there is this interplay with physical stress and environmental stress on the body.
Great. Just a couple more questions, Avi. We've got just a few more minutes. In terms of, I guess, related to that previous question, around also about other types of work exposures. So, mental demands, emotional demands. Again, has there been a lot of work either separating, adjusting for those factors, or even understanding the interplay between different types of demands, both not just physical, but also emotional and mental, and how those things impact in combination?
Yeah, I think it is something that I think is really undervalued so far. There's been some great work looking at them separately, and some emerging work looking at their interplay. And what I've seen is that having a lot of psychological demands can impact your ability to engage in physical activity outside of work. Again, I'm just trying to hit home this idea that we still need to be very physical. We need to be meeting our recommendations for good health, regardless, of what we're doing. And so if you're engaged in a very stressful job or you have a lot of demands on the job, that what I've seen is seeming to impact, our ability, our energy, our to be able to engage in physical activity outside the job. And in terms of kind of what I've seen and some of the research that we've done as well, in terms of the interplay of physically demanding work and psychologically demanding work, they can come hand in hand. I mean, just thinking about the strain again on your heart, there is research that suggests that psychologically demanding work can impact your heart. And again, it's all about like this compounding effect. If you're also then putting a lot of physically demanding load on your body, and you've already stressed out, and you increase your blood pressure that way, I don't see it being a positive thing. And I think it's about finding a balance, both psychologically and physically on the job.
Right, thanks very much, Avi. So we're almost out of time, so we're going to end the questions there. If people do have other questions for Avi, please don't hesitate to send him a note at abiswas@iwh.on.ca. For those of you who would like to hear more about our speaker series presentations, there is a link at the bottom of Avi's slide here at the iwh.on.ca/events/speaker series, or you can subscribe to hear all about the research we're doing at the Institute for Work and Health. Just a reminder for those of us or for those of you who are interested in the speaker series presentation, our next speaker series presentation will be on June 8th, and that will be presented by Cam Mustard, who will be answering the question, what can hospital emergency records tell us about the incidence of work-related traumatic injuries in Ontario? So once again, thanks everyone for your attendance today. Avi, thanks for a great and interesting presentation, and thanks everyone for the comments and questions, and we'll see you next time. Goodbye.
Thank you.